To avoid complications, you want to give the patients the pros, the cons, and the alternatives. Yo, what up? It's a tip of the week, and today we're gonna discuss how to avoid complications during extraction. All right, guys, don't pay attention to the capper. As a matter of fact, let me take this thing off. I just got finished doing an extraction, and I want to make sure that you guys get this information as soon as I get it. So I just got finished taking out a set of thirds. Patient's doing well. My dental assistant is doing some post-op instructions now. But the whole purpose of me creating this channel is simply so that you'll smile after surgery. I'm Dr. Jared Williams. I've done over 10,000 cases in a very short period of time. And as I practice as a concierge dental surgeon, going from office to office here in Houston, Texas, I saw that there is a disconnect. And what I want to do is have doctors smile after surgery in addition to patients. So the reason why you're watching this channel is because you want to smile after surgery, and you want to know that what looks hard is often easy. So without further ado, this week I'm going to talk to you about how to prevent complications when you're doing extractions. All right, come on into my world and let's get this thing going. All right, number one is this. You want to pray. Now, I know there are certain individuals out there that aren't praying individuals, but whatever. If you want to smile after surgery, you better pray. And my way of praying is not just, oh, please give me. No. My way of prayer is following principles that are going to give me success to my prayers. Because there's no point in saying I want something if you're not going to put the steps in place to actually get it, especially if the steps are already written down. All right, so the number one proverb I like to think about when I'm thinking about this case is this: in the multitude of counselors, there's wisdom. And I believe that you're wise because you're watching this channel, and because I've gotten to 10,000 cases, you're learning on how you can smile at surgery. And one thing I don't want you to do is bang your head up and against the wall by forcing to get your patients comfortable and you're having bad results. And so that's going to be the first tip on how to prevent complications. Get around individuals who've been doing it at an excellent level and getting the results that you want for a long time. I know there's so many channels out there that tell you, hey, you need to do this, do that. But if they don't have 5-star reviews, if they're not giving back in the community, and if their focus is profits over patients, you may want to look elsewhere. You know, I was looking at this video and this guy, he was mimicking exactly what this young lady's doing, and hopefully I could show you the video. And as you can see, this guy's doing this workout and this video went viral. And what happened was he's following this young lady who's playing, and you can look at the video. And it's crazy because a lot of you guys, and myself included, you know, you see something that's sexy on TV and you want to mimic it and you want the results now. But if you remember that if you want to decrease the complications, get in the company of a number of wise individuals, and there's wisdom there, because all they're going to do is do the best practices. They're going to focus on scholarly journals. They're going to focus on evidence-based dentistry, and that's where you want to be. And so you could have success on one case, but can you have success on 10,000 cases and have 5-star reviews? If you're doing something like that, then guys, you're in the right path. But if you're not and you want to have consistency along the whole path, what I definitely want for you to do is continue taking tips. As a matter of fact, stop what you're doing, click the link right now, subscribe, because I need to know if this channel is actually helping you guys out there. And the only way I know how to do that is if you're smashing the like back button, sharing, and getting your friends to subscribe, because I'm doing this for you guys. And if I'm gonna do it, I wanna make sure that you guys are growing and smiling after surgery, guys. So click the like button, smash the subscribe button, share with your friends, and let me know, hey, what can I do to serve you best? Because this is what this channel is all about. All right, so let me get off my rant. Let's keep it moving. Number two is this: to avoid complications, you want to give the patients the pros, the cons, and the alternatives. Now, the pros are going to be anything that's going to be a reason why you want to do this procedure. Not all procedures you want to do, but you want to let the patient know, hey, this is the rosy side of the fence. This is where you want to be. This is the reason why. This is good for you, so on and so forth. Then you want to transition into the alternatives. These are reasons why you don't. This is why the grass isn't green on this side of the fence. And you want to let them know. You don't want to make either side worse off than what it actually is, but you definitely want to make sure that you're giving them all the alternatives, because last thing you want to do is just paint a rosy picture, and last thing you want to do is paint a terrible picture, all right? The next one is give them the cons. Why you should literally acknowledge the fact that this is the reason why you don't even want to touch this. Like, this has a higher likelihood of happening, and these are the reasons why. So alternatives are going to be like, you know what, this is certain things if you don't do anything. This is the reasons if you, and cons are going to be like, okay, well, you're going to have some numbness. Like, that's going to be the con. And so anytime I give that information to an individual, what it does is it allows me to process it as I'm speaking to the individual. And as you speak to your patients, you're going to be doing the same thing. And what I like to do is this. If you see this little view board, like I'm in the office, this office I'm working in today here. This office is a little bit, it's advanced, but they still have view boxes. But we have this about a almost six-figure machine sitting right behind me. So it just depends on where I am in the whole in the week or the month or so on and so forth. But if you put the x-rays on a view box or you pull them up on the screen, what you want to do is show them everything, and you give them the pros, the cons, and alternatives as you're reading the x-rays for them. When you read the x-rays for them, what you're going to be doing is you're going to be saying, do I really want to take on this case? Is this something I really want to do? Or should I just punt this off to somebody else? And then the patient's going to be like, I don't know if I want to get numb. I don't know if I want to pay this amount. And I don't know about this doctor, because this doctor doesn't seem to be giving off a fair amount of confidence that I'm needing right now. And so when you give them all the pros, the cons, and alternatives, guys, man, over the last decade, I've done that, and I don't get calls based upon, oh my goodness, I am in the hospital. Like, those don't happen, and you're probably not going to get those routinely, I mean, regardless. But the one thing you're probably going to get is like, hey, I'm still bleeding, or hey, I have a dry socket, or hey, something's going on. But when you give them all the pros and cons and alternatives, those individuals are literally going to be like, okay, Dr. Williams told me about this. I don't have to concern myself with it. He's already let me know what I need to do, so I'm good. And if you continue to follow in that realm, everything is going to just be fruitful, just so nice. And so I really want for you to take that in consideration. So as you are treating your patients, you're giving them the whole kit and caboodle, pros, the cons, and the alternatives. Number 3, so if we're going to be doing how to mitigate complications when it comes to extractions, one thing I want you to know, the roots tell the story, or the morphology. Some of you guys like big words, but the roots tell the story. If the roots are super bulbous, you're gonna have some issues. You're gonna have some issues. If the roots are curved like this, like they got like rheumatoid arthritis in the fingers, no offense against anybody who's rheumatoid, but anybody who has the curling up and they can't necessarily move, or significant arthritis in the roots, you know you're gonna be in for a challenge. And so those are different things. And so when you keep that in mind, your complications are gonna go down. And you would pick this up in tip number 2 as you're telling the patient, hey, this is gonna be, root's gonna be wrapped around the nerve, or this is gonna be in a place that it's gonna cause more complications. And you're just gonna go over that with them so they're comfortable and they have a good feel on what's gonna end up happening. But the roots are really gonna tell the story if you smile at surgery or if you don't. All right, guys, I hope you're really paying attention to what we're putting out here, because this information literally allows me to go in from office to office, from see patient to patient, and smile after surgery, and work with assistant to assistant. As a matter of fact, I don't even bring my assistant with me. So I'm literally working with a new office, a new assistant. And if I could do this on a daily basis, you could essentially do this in your office where you're working with the same team each and every day, and at least you know the patients. The patients that I see, I've never seen them a day in my life, and when I'm seeing them and I'm looking at their x-rays, I'm following all this information to the T. And let me get on a rant right now. So when I like to eat my own dog food, and what that basically means is that I like to do things that practice what I preach, in a sense. It was interesting. I was signed up for this course and I actually followed the course. And I was just speaking to one of the course instructors, and she was just like, she said, Jared, did you know that you're the first person who's called me that did not lose money? And I was like, huh? Now, this young lady has been practicing in her fields for the last 20 years. So what I've been doing, chump change. Her, 20 years, times 2. And so she's telling me like, did you know that you're the first person? And I'm like, what? It's 2020, like we're on the cusp of 2021. She was like, you're the first person since 2000 that has called her before they've lost money. Guys, a little bonus within the tip of the bonus is, guys, if somebody gives you information, don't do it how you want to do it. That's how you lose. All right, we're talking about how to avoid complications. Don't do step 1 and say, you know what, I don't do step 2. That's how you lose. When she told me, hey, you're the first person, I was thinking to myself, well, I just went down the list. I didn't do anything that was super intelligent. This is the first time me operating in this particular arena within business. And I was just like, all I did is follow the instructions that were given to me in the course. And so guys, when you go and get this information, don't get wise in your own eyes. Get this information and literally take a step back and follow it to a T. Don't get so anxious. And that brings me into my bonus tip, my real bonus tip. And that is, don't rush. Guys, do not rush. I want to leave you with a vocabulary for today. And you're not going to necessarily find this within the dental community, but this is something that is going to allow you to avoid complications. And I want to read it to you so I don't screw this up. And that is risk. All right. The definition of risk management, or the term that I wanted to use, is the mitigation of risk. And that says this: risk management is the identification, evaluation, and prioritization of risk, followed by coordinated and economical applications of resources to minimize, monitor, and control the probability or impact of unfortunate events, or to maximize the realization of opportunities. Guys, if you're watching this tip right now, all I have done is given you this definition, which is risk management, in this whole entire tip of the week, specifically within dentistry. And guys, since I know that you want to smile after surgery, since I know that you want to know what looks hard is often easy, since you're sharing this and liking it, smashing the likes button, and letting me know that these tips are working for you guys, they worked, they will work, and they will work for the next however many years we're on this planet. So guys, I know that sometimes it can get challenging. I know sometimes it's just like, man, I just want it now. But I'm telling you guys, and I'm speaking fast because I'm really passionate about this. I really want for you guys to don't rush and be patient, because I'm letting you know, after 10,000 cases and operating in different businesses, because I'm a serial entrepreneur, like, guys, these principles will consistently stay the same across the board. I don't care if you're applying it within implants, I don't care if you're applying within surgery, I don't care if you're applying it with prosto, whatever the type of dentistry that you are operating under. Specifically, this channel is for surgery and implants, but I want you to know the main thing is going to be to don't rush. Be patient, and that's how you'll smile at surgery. You follow these tips to the T, and you'll be like myself, how this lady coined me. I'm not giving myself any accolades. She said I was the first person in her 20-year career that called her before they lost money. And guys, if you are a smart doctor, which I know you are because you're watching this channel as we speak, you're gonna be the same exact way. All right, guys. I'm Dr. Jared Williams. I have another patient I need to see right now. I'm about to put on my capper and get out of here, but I really want to let you know what looks hard is often easy, so make it a great one. Hit the like button, smash subscribe, and let your patients know they're going to smile after surgery. Make it a great one.